To the latest on the Nehawu strike now, and the Labour Appeals Court has granted an order interdicting the Nehawu health workers' strike with immediate effect. Earlier, the Health Minister, Dr. Joe Phaahla, conducting site visits and assessments of some of the worst affected striking areas, some of the areas hit worst by the strike, at health facilities around the country. The Health Department saying the majority of the hotspot facilities around the country have been accessible to patients despite the strike. Tumaole Mohlaoli joins me now in our studios. He's been monitoring this. Tumaole, good afternoon to you. Firstly, the Labour Appeal Court. You can only go to the Constitutional Court after this. What's Nehawu's response so far to this ruling?
Well, Nehawu's response so far to this ruling is basically trying to gauge exactly what the way forward. And as you've just mentioned, the Constitutional Court will be the last gap stop. But of course, the union saying that its back is against the wall when one looks at the price of living and what has been put on the table. It says that 10% is just the bare minimum it can actually do for its members in terms of trying to make sure that they get a living wage, because with inflation and the price of living is saying that people are just working to basically service their debt, and many of them have gone to the wrong avenues to get, to make ends meet, and so this debt keeps growing, and some of them are going to the so-called mashonisas. Majority of the mashonisas, a colloquialism about the so-called loan sharks. We do know that, of course, with the loan shark avenue, the interest rates and the repayment rates become something of a figure that can just balloon at whim. So many of the workers are saying that 10% is just would basically make them make the living wage. But we spoke to Dr. Joe Phaahla just on the outskirts of the strike, and to get what more can be done in terms of trying to accommodate the workers, and whether this strike is now officially over and what the court interdict actually means. Let's see what he has to say.
We'll assess as the day goes by, because the report we are getting is that it's getting better. So there might be just a few there to stabilize, and then here and then the Sebokeng hospital. I think once things are cleared up, Sebokeng is also quite a priority. I'm sure during the course of the day, some of the SNDF, if they give us more, we'll ask them to go and help at Sebokeng.
This, Tumaole, must be what, the first, second, third court application by Nehawu, the third application in this case about the strike? They must be quite disappointed.
They certainly are quite disappointed, because they felt that they had a very credible case that they put forward, and that the health department should have just met them halfway. But if you listen to what Dr. Phaahla has said there, basically, in terms of the hotspots, certainly a lot of the workers had resigned themselves, the Nehawu members, to basically, saying, we have two options. Either we go back to work, or we face this, never-ending battle. And once it goes to Constitutional Court level, it might even be a matter of several more months. At this particular stage, if the workers decide not to return to their posts, it would then be an unprotected strike. Whether Nehawu has got any more room to maneuver bar that particular Constitutional Court process remains to be seen. They were digging in their heels, saying that it is a protected strike. When I did leave the hospital at Mogwerane Regional Hospital, they were still going back to the shop steward to try and see what would be the way forward. When I went to Sebokeng as well, which was another hotspot, the union leaders there said that they've got 72 hours in terms of their understanding before they have to tell members to go back to work. They will then conduct basically feedback sessions and see what the mood is amongst their workers, if the workers want to take it a step further. Of course, what's at stake here, Stephen, despite the fact that they've lost the 10%, which they were looking to basically get to pin government down to, is the fact that if they don't go back to work following this court order, it could mean dismissal for many of the Nehawu members who have been on this strike. And it's something they can ill afford at this stage. So this is where, of course, the shop steward now find themselves in terms of weighing up what the way forward is.
There's so many different elements to this. I mean, just last week here, the South African Democratic Teachers Union sat to using language we've never seen from one COSATU union to another, saying we no longer see Nehawu as a sister union, but as an opponent. That's after Nehawu members had disrupted that event that they had been at. Then we have the quite defiant press conference, it seemed, from Nehawu yesterday.
That's Nehawu just basically trying to, say that in terms of the actions that they've taken, the status quo basically gives them or absolves them of any responsibility in terms of trying to call their members to order, saying their members are basically desperate. They are now between a rock and a hard place, and it should be understandable, and other unions, sister unions, should basically sympathize with the workers, because it is reached breaking point as far as living conditions and the wages not meeting the minimum requirements of members. Many members are saying most of their salary now goes to transportation. Not only their transportation to and for work, but they've got families, they've got extended families, they've got children that they're trying to get to school, and therefore after transportation there's no more income for food, no more income for power in these very difficult times with load shedding as well. So one can only sympathize there. However, with the court order, it certainly would seem that the direction that the workers can have open to them now is to head back to their posts.
There's a strange thing that happens in government in these moments, because the health minister is the person stuck in the middle. He sort of represents government, but he's not the one who negotiates. The one who negotiates is public service administration.
Yes.
And the minister there relatively quiet around this. I mean, a new minister as well.
Relatively quiet about this, and his whole thing is to try, it seems, to play peacemaker. He seemed to be very sympathetic to the workers, but at the same time saying that what happens when workers leave their posts and people lose their lives, as has been reported allegedly at some of the facilities, particularly around the Mogorane Regional Hospital in Vosloorus. There was that allegation that because some of the union members, including key service members, the nurses, weren't at their stations, there was patients who lost their lives. When the minister was speaking about that, you could see a very grave, very sullen demeanor coming up over him, saying that it goes beyond the rands and cents. The people have taken an oath of office, and an oath that basically means that they have to put the patient first. And when you have a loss of life, further investigations are going to go into play right now to determine who was not where when they were supposed to be. And if it is indeed found that negligence came into play, despite the context of this industrial action, that means people could lose their jobs and they could lose their licenses, which then, of course, defeats the purpose of this whole industrial action, doesn't it, Stephen?
Tumaole Mohlaoli, very sobering. Thank you very much indeed. Well, that's the latest we have for you on the Nehawu strike at the moment.